Everyone. At the outset, I would like to thank Dr. Hilda and KSOS for this opportunity. I'll be presenting on the topic a gateway ticket, cornea tissue Slitlamp evaluation and specular evaluation. As everyone knows, a systematic evaluation and documentation helps the operating surgeon to know the quality of tissue and to improve the outcome of surgery. It helps the surgeon to choose the tissue according to his requirement and depending on the host factors. So prior to evaluation, the details of the donor tissue should be evaluated. The time of death, cause of death, past history, and details of the torchlight examination should be confirmed. The color of the media should be assessed, and tissue should be warmed to room temperature prior to evaluation. The tissue is the glass bottle containing the tissue is mounted on a slit lamp with the help of a stand, and the features are evaluated. When it comes in a viewing chamber, as in light forcing medium, it can be directly evaluated. Routine slit lamp evaluation methods like parallelepiped view, narrow slit, diffuse illumination, specular evaluation, and retroillumination are employed. For the sake of documentation, cornea is divided into a central area, paracentral area, mid-peripheral area, and a peripheral area. Each layer is assessed in detail. Epithelium is evaluated for the extent of exposure, sloughing, and presence of any debris or foreign body. Exposure is a degradation or edema of the epithelial layers as a result of eyelid remaining open after the death. It can be accompanied by sloughing also. In case of mild exposure, only the superficial layers of the epithelium is affected, and the superficial surface, corneal surface, is smooth and regular. In mild to moderate exposure, there will be loss of partial layers of the epithelium, resulting in an irregular surface. In moderate exposure, there will be even more deeper involvement, and in severe exposure, there would be complete sloughing of the epithelium. Sloughing is the absence of epithelium which can result from trauma or intrinsic disease. The percentage of sloughing. So epithelium sloughing happens when there is absence of epithelium, which can be a result of trauma or any intrinsic disease. The percentage of sloughing, that is the amount of sloughing on the corneal surface, is documented. Coming to stroma, stroma is evaluated for the extent of arcus, edema, striae, infiltrates, or opacities. The arcus is graded depending upon the clear zone, that is the area which is devoid of the arcus. It is graded as mild arcus when the clear zone is more than 8.5 and severe arcus when it is less than 6 mm. Coming to edema, edema is graded as mild edema when only the anterior layers of the stroma is affected, and mild to moderate when there is extension to the deeper layers of the stroma, and moderate edema when all the layers of the stroma are involved. In severe edema, there will be thickening of the stroma and opacification of the stroma as a result of severe edema. Coming to striae, striae are grayish white lines in the stroma. It can occur at any depth, and it usually coexists with the corneal folds. Stroma should also be evaluated for the presence of any infiltrates, foreign bodies, ectatic disorders like keratoconus, or any dystrophies. All of these are contraindication for utilization of the tissue for any optical purposes. Scars also should be evaluated in detail. The size of the scar, that is the diameter in case of rounded scars, and length of the scars in linear scars should be assessed. The depth of the scars should be evaluated, whether it's in the anterior stroma or into the deeper stroma, and location, whether it's in the central area or peripheral area, should also be documented. The Descemet's membrane is evaluated for folds, any defects, or any detachment. Folds, as everyone knows, is caused by thickening of the stroma by edema. Folds are graded as few folds, few to several folds, and numerous folds, depending upon the number and type of the folds. And depending on the intensity, it is classified as mild folds when the valleys and peaks between the caused due to the stromal edema are thinner and shallower. And in mild to moderate folds, it would be even more deeper and wider. The extent will be much more in case of severe folds. Any defects in the Descemet's membrane as a result of surgery or which has occurred during harvestation of the tissue also should be documented. Coming to endothelium, endothelium is evaluated for the extent of stress lines, cell dropouts, and specular evaluation findings. Stress lines are linear opacities at the level of endothelium. These occur while tissue harvesting. When there is folding of the tissue or undue stress on the tissue, there will be rupture of the endothelium or stretching of the endothelium, resulting in stress lines. Stress lines are not much important if it is in the peripheral location, but when it comes to the central location, it can interfere with the quality of the tissue. Loss of endothelial cells are called cell dropouts. These appears as dark areas on specular reflection. Cell dropouts are graded as when mild cell dropout, when there is 5 to 15% of a cell loss in the area of specular reflection. Mild to moderate when the loss is around 15 to 30%, moderate when it is between 30 to 50%, and severe when it is above 50%. Coming to specular evaluation, as shown, specular evaluation is performed with the help of a eye-bank specular microscope. The glass bottle containing the medium is partially immersed in normal saline, and the specular evaluation of the endothelium is done. The details evaluated include the cell density, standard deviation, coefficient of variation, and hexagonality. And from the image, the extent of polymegathism and pleomorphism is also evaluated. So in the first image, you can see that the cell density is 3145 per millimeter square, which is a reasonably good count. And coming to the image, you can see that the hexagonal architecture is well maintained. And the cell size is almost regular, and there is not much of a polymegathism or pleomorphism. Whereas in the second figure, you can see that the cell density is around 609, which is very less, and the image is not clear. You can roughly make out the cell size is grossly enlarged. So there is a lot of polymegathism. And coming to the third image, you can see that the cell count is reasonably good. It is around 2778. But you can see that there is some amount of around moderate amount of polymegathism and pleomorphism. The cell size is increased. There are cell shapes of different shapes. A triangular cell is there. There is a 5-sided pentagon-shaped cell, and some rectangular shaped cells are also this thing. And other information include the presence of jaundice or lens status. This is noted by the technician performing in situ excision. The scleral rim size and regularity is also important because it decides whether the tissue can be mounted on artificial anterior chamber for lamellar surgical procedures. So finally, at the end of all these procedures, the findings of tissue evaluation are noted on a cornea evaluation form. And finally, these details are evaluated by the medical director, and he or she sanctions whether this tissue can be utilized for which all surgical procedures. And final release will be done by the medical director. So when a surgeon receives the form, the main findings of cornea tissue evaluation will be available for the surgeon. The specular evaluation findings also will be issued to the surgeon. So finally, the standardization of the evaluation technique and parameters helps in providing good quality corneas and thereby successful outcomes. Tissue evaluation helps to assess the quality of the procedures ranging from tissue harvesting to the storage of the tissue. Documentation of findings helps the operating surgeon to identify the tissue characteristics and suitability for the surgery performed. Thank you.
Thank you, David, sir, for the beautiful presentation with all the photos, and every slide has tailored down this big topic to us in a very nice way. Thank you.